Hello everybody and welcome to the Thursday edition of Video Clips. New guidelines for the diagnosis and treatment of depression in adolescents are very concerning, recently published guidelines, and parents should be on guard, which is why I'm discussing this today. The guidelines were developed by the American Academy of Pediatrics, the Canadian Pediatric Society, and psychiatric associations from both the United States and Canada. Rachel Zuckerbrot is the lead author of the Guidelines for Adolescent Depression in Primary Care, and according to her, over 50% of teens with depression are not diagnosed, and most teens who are depressed don't get any type of treatment. The new guidelines call for universal annual screening starting at age 12 by pediatricians and other primary care doctors in order to identify children who are depressed or are at risk of depression. Dr. Zuckerbrot states that primary care providers are in the best position to do this since they see kids regularly for health checkups, school physicals, sports physicals to clear participation, that sort of thing, and then common illnesses. She reports that the new recommendations emphasize collaborative care between pediatricians and the mental health profession, and that patients really benefit from this type of arrangement. The authors state that screening programs can be successful in part because adolescents rarely refuse screening. Well, of course they don't. Most teens consider doctors to be authority figures, and they therefore tend to do what they're told. So if they're asked to complete a questionnaire, they're highly likely to do it. While compliance may not be an issue, accuracy seems to be. Discrepancies have been noted, for example, between the self-assessment questionnaire a teen fills out versus the questionnaires that parents are filled out, with one study showing that only 15% of the time do what the teens report and the parents report are in agreement. The authors advise that clinicians need to reconcile the differences between the two in order to determine if the teen is truly at risk or is depressed. The authors also caution that, quote, reliance on adolescent self-report depression checklists alone will lead to substantial numbers of false positives and false negative cases. Thus, the authors advise that assessment should include follow-up clinical interviews and then, quote, information from other informants, and this would include parents, as legally permissible, and assessment for other psychiatric conditions too. What really concerns me about this is interviewing other informants. And the reason is that this might include school officials, teachers, that sort of thing. Now, here's the practical part of this. It's very hard to imagine how all of this could be done by a busy general practitioner or pediatrician and staff members, most of whom are not qualified to complete the tasks anyway. In order to sort things out and arrive at a firm, I would put air quotes around it, diagnosis, referrals to mental health professionals will be required in many, if not all, cases, and this is, of course, fraught with risk because referrals to mental health professionals usually result in drugging when we're talking about conditions like depression. Pediatricians are advised to continue assessment even when the screening is negative if the doctor has reason to believe that the teen might be depressed. Now, this acknowledges both the limitations of the tests and encourages disease mongering. It is almost certain that some pediatricians and family doctors will become hypervigilant in looking for depression, particularly in light of recent events such as the Parkland, Florida school shooting. Responses to these types of events almost always include an emphasis on herding more people into the mental health system, of course ignoring the fact that these people usually are in the mental health system and taking the drugs at the time that they commit these violent acts. And we also know that when doctors start looking hard for abnormalities, they're usually successful at finding them. So charging doctors with look until you find depression scares me a lot. Indeed, the guidelines seem to encourage doctors to leave no stone unturned, stating that depressed adolescents are often not able to identify themselves as being depressed. Doctors are encouraged to look for symptoms that can be signs of depression, which include irritability, fatigue, insomnia, sleeping more, weight loss or weight gain, decline in academic functioning, and family conflict. Now, the problem with this approach is particularly the physical symptoms like fatigue and weight gain can be signs of poor diet and lifestyle habits, which should be considered before you ever suspect depression. But doctors have even less training and ability in counseling patients about these issues than depression screening and management. According to the recommendations, if teenagers are diagnosed with depression, Initial approaches should include active support and monitoring, and then if needed, evidence-based treatment with medication and psychotherapy. Acknowledging the risks of commonly prescribed drugs for depression, doctors are advised to watch for negative changes in behavior and worsening mental health after initiating treatment with drugs. Zuckerbrot says that many pediatricians are under the mistaken impression that their scope of practice does not include prescribing antidepressant drugs, but the new guidelines let them know that prescribing the drugs is really included in the standard of care and that, quote, the American Academy of Pediatrics is supporting them. In fact, doctors are encouraged to recommend, quote, scientifically tested and proven treatments, end of quote, like therapy and SSRIs. To their credit, the authors do recommend cognitive behavioral therapy, stating that it can resolve major depressive disorders and allow teenagers to eventually discontinue medication. They also state that treatment goals can include things like diet and exercise and resolving issues at home. But the likelihood that the teenager and his or her family are going to end up with a cognitive behavioral therapist who's really good, not so great, much more likely that a psychiatrist is going to prescribe drugs. So the problem we have here, in summary, is that pediatricians and family practice docs are not trained to perform assessments. They know almost nothing about optimal diet. They have no training on how to teach diet and lifestyle change in their practice setting. As a result, I'm confident that referral to psychiatrists, the collaboration that I mentioned earlier, is highly likely, and let's face it, psychiatrists usually prescribe drugs for psychological issues. So, I have several concerns about this. Mobilizing general practitioners and pediatricians to look for depression in teens will almost certainly result in more diagnoses. It's highly likely that a lot of these teens are going to get herded into the mental health system, and they're going to be tested. Well, first of all, they're going to be tested without their parents' permission, and that's a major, major problem because the guidelines say to do this, and they really don't have to ask parents. They also will be tested without ever having a discussion with the parents about the risks associated with this, and some of the risks include, for example, the child being labeled. And disclosure of information to teachers and others as part of this investigative process to find out what's going on with this kid. And then, of course, if they're referred to the mental health system, which I think a lot of them will be herded into the mental health system, the risks associated with drugging, which is likely to occur. So I think that if a pediatrician sat down with parents and said, look, we've been advised that we should be screening for depression, I'd like to do a test on your child. I just want to let you know before your child takes this test. The test is unreliable. I have no experience doing this. If I detect anything, we can't deal with it here, so I'm going to send him to a psychiatrist. He might get drugged. If we're uncertain, we may contact teachers and that sort of thing to have a discussion about it. And your child could be labeled with depression for life. And by the way, those drugs are horrible, and the kids who are committing these violent acts at school are usually taking them. Now, how would you like for me to administer the test to your child? 100% of all parents presented with the truth would say no. I mean, it was just last week or the week before when I covered an article showing that when people are fully informed, utilization goes way, 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 way down. Well, my advice to parents has always been stay with your child when visiting a pediatrician or family doctor. Screening for depression is only one of the dangers associated with leaving a child alone with a doctor. Over the years, parents have told me a lot of nightmare stories of doctors asking for time alone with their kids in order to badger them about things like drinking milk and the HPV vaccine. Parents can nip these suggestions in the bud by being in the room and letting doctors know in no uncertain terms that issues like screening for depression, drinking milk, and useless and harmful vaccines are not open to discussion. This is one of these times when I'm sure a lot of this comes from the place of good intent. Let me say that. But the road to hell is paved with good intentions. Let's just put it that way. So this is one of those times when it really is important for parents to say, I'm going to be in charge. I'm going to be very judicious about what I allow doctors to do to my kids. And that's another thing I've heard a lot from parents over the years who are very, very regretful of turning their children over to doctors and allowing things to happen that they look back now and say, I should have known, I should have been more diligent, I should have checked it out, etc. So anyway, very distressing. Anytime you get into this universal screening, and this is quite different. I want to make this point before I forget. This is quite different than screening for a disease where the markers are clear. High cholesterol is high cholesterol. High blood pressure is what it is. Nobody looks at the blood pressure reading and says, I wonder what that means, all right? So we're talking about very subjective judgment here, which makes this very, very dangerous, particularly in the hands of people who don't know what they're doing. So that's my warning for today. That's all for today and all for the week. As usual, pass this on to anybody who you think might enjoy watching it. I'll be back to you on Tuesday with more news.